Medical ethics and professionalism are essential foundations in medical practice that ensure that physicians provide the best care for patients, while maintaining the dignity, public trust, and quality of the medical profession. Medical ethics refers to the moral principles that guide professional behavior, while professionalism includes attitudes, values, and actions that demonstrate integrity and commitment to the highest standards of medical practice. The following is a detailed explanation of medical ethics and professionalism, including basic principles, their application, and challenges faced in the medical field. 1. Definition of medical ethics. Medical ethics is a branch of ethics that focuses on the moral principles and values that govern the behavior of medical personnel in providing healthcare to patients. Medical ethics seeks to address moral dilemmas that arise in medical practice by providing guidance on what is right and wrong in medical decision-making. A. Principles of medical ethics. Some of the basic principles in medical ethics that are used to guide medical decisions and actions include: 1. Autonomy. This principle refers to the patient's right to make decisions about their own care. Physicians must respect patients' wishes, provide them with sufficient information to make informed decisions, and must not pressure patients to follow unwanted medical advice. Example: patients have the right to accept or refuse treatment, as in the case of informed consent. 2. Beneficence. Physicians have a duty to act in the best interests of patients by providing the best care for their well-being. This includes efforts to reduce pain, prevent disease, and improve the patient's quality of life. B. Informed consent. Informed consent is one of the key principles in medical ethics. This means that patients must be given sufficient information about the diagnosis, treatment options, potential risks, and benefits of the medical action to be taken, so that they can make a conscious and informed decision. 2. Definition of medical professionalism. Medical professionalism refers to the attitudes, behaviors, and character expected of a doctor in carrying out his duties. This professionalism includes moral values, interpersonal skills, integrity, and commitment to quality health services. A. Characteristics of medical professionalism. Some characteristics of professionalism in medicine include: 1. Integrity. Professionalism requires doctors to have high integrity in all their actions, both in relationships with patients, colleagues, and the community. This includes honesty, fairness, and a commitment to maintaining professional ethical standards. Example: admitting medical errors and correcting them, and not taking personal advantage of patients. 2. Commitment to professional development. Professionalism also involves continuing to learn and grow. A physician must continually update his or her medical knowledge and skills to provide the best care to patients. Example: Attending continuing education and training to ensure medical knowledge remains current. 3. Interpersonal skills. A doctor must be able to communicate well with patients and their families, and work effectively with the medical team. Good communication skills enable doctors to provide clear explanations, empathy, and emotional support to patients. Example: establishing a relationship of trust and respect with patients, and explaining medical procedures in a way that is easy to understand. 4. Social responsibility. A professional doctor also has a social responsibility to serve the community and play a role in health promotion and disease prevention, not just focusing on individual treatment. Example: participating in public health programs or health education to raise awareness of the importance of a healthy lifestyle. B. Professional ethics in daily practice. 1. Facing ethical dilemmas. In medical practice, doctors often face ethical dilemmas, such as choosing between providing expensive but less effective treatments or respecting the wishes of patients who refuse treatment. Professionalism requires doctors to make decisions based on a balance between ethical principles. Example: maintaining a balance between providing the best care and respecting the decision of patients who refuse treatment. 2. Obtaining patient consent. As part of professionalism, doctors must always ensure that they have obtained the patient's consent for any medical treatment or procedure, after providing a clear explanation of the risks and benefits. Example: before performing surgery, doctors must ensure that the patient understands all relevant information and gives informed consent. 3. Maintaining patient confidentiality and privacy. Maintaining the confidentiality of patient information is an important aspect of professionalism. Physicians must always maintain patient privacy, both in medical records and in private conversations. Except in very limited circumstances according to law or medical necessity. Example: do not discuss details of a patient's condition with others without the patient's valid permission. 3. Challenges in medical ethics and professionalism. Challenges in implementing ethics and professionalism in medicine arise from various factors, both internal and external. Some of the challenges that doctors often face in maintaining ethics and professionalism include: A. Pressure from the health industry in an increasingly commercial health environment. Doctors often face pressure to meet financial targets or use certain technologies and drugs that do not always provide the best benefits for patients. These challenges can add to the complexity of making the right decisions. B. Resource issues in health systems with limited resources. Doctors are often faced with difficult decisions about treatment priorities. Sometimes the best option for a patient may not be possible due to resource constraints, which can create ethical dilemmas. C. Medical and social dilemmas. Social dilemmas, such as how to deal with patients who cannot afford treatment or who refuse treatment, can be a major challenge for physicians who wish to act in accordance with the principles of beneficence and justice. D. Influence of new technology and innovation. The rapid development of medical technology often adds complexity to medical practice. With the emergence of new techniques that have not been fully tested in the long term, physicians must be able to critically evaluate this technology and use it in a way that is ethical and appropriate to the needs of the patient. 4. Conclusion. Medical ethics and professionalism are important foundations in medical practice that regulate how doctors interact with patients, colleagues, and the community. Basic principles such as autonomy, beneficence, non-harm, justice, and confidentiality are guidelines for making good and ethical medical decisions. Professionalism, which includes integrity, professional development, interpersonal skills, and social responsibility, must always be maintained by medical personnel in providing the best service. Although challenges in implementing ethics and professionalism always exist, maintaining these standards is key to building trust and quality in medical practice.